to the Oral Health Education Series, Module 9, Navigating the Dental System, Part 1. I'm Dr. Brecky, and I'm here with Ready, Set, Smile for the last module of this training series. We hope you've enjoyed it so far. So Module 9, Navigating the Dental System, it's not a comprehensive training course, but a brief overview and educational resource designed to focus on the oral health delivery system and dental care in the United States. These materials are subject to copyright by Dr. Brecky and Ready, Set, Smile. So, navigating the oral health delivery system. What we'll review is health coverage, public versus private coverage, dental coverage, the lack of coverage, access to care, utilization of care, free care, and accessing available resources. So even though oral health is integral to one's overall health, oral health care and dental coverage are mostly separate from medical or regular health coverage or insurance. It's really too bad. That's right, general health insurance coverage typically does not cover dental needs. Thus, millions of Americans are left without dental coverage. So let's just take a step back to discuss the healthcare delivery system in the United States. Healthcare delivery can be divided into coverage, access, and utilization. Each three are essential in obtaining healthcare in the United States. So we're first going to start with coverage. Well, what is it? Coverage refers to insurance. Health or medical insurance is designed to protect individuals against losses related to ill health. It's very important, but of course in the United States we don't have a system that provides coverage to everyone. So what coverage or health insurance actually exists? Well, there's medical, then there's dental, there's vision, there's prescriptions, there's mental health, there's wellness. There are multiple different kinds, and they're not always all included under the same entity of medical. So it's important to know what kind of coverage you have, what kind you're looking for, and really knowing what you're getting out of your coverage. So we know, ridiculous. Medical coverage does not always cover all parts of the body, such as the teeth. We're trying to change that. So, medical coverage, where does it come from? Let's just start with overall medical and health coverage. There's two possible subsets. There's either private, which is employer-sponsored or individually purchased, and there's public, which include things like Medicaid, Medicare, Veteran Affairs or TRICARE, and the Indian Health Services. So medical coverage plan types. If you've delved into this area, you've probably heard the terms HMO, PPO, ESO, POS, HDHP, HSAs. What's important here, find out more about your own plan. Be engaged in this process. Where you are covered, what is covered, and who to contact with questions. That's the most important thing. And what's even more important, delaying preventive care will only lead to more expensive medical costs later, so do not delay care, especially based on fear of what type of coverage you might have. So let's review the public sector of medical coverage. First, there's Medicaid. Medicaid was established in 1965 as a means-tested entitlement program run by individual states to provide services for underserved groups. Medicaid now provides care to low-income families, disabled children and adults, pregnant women, individuals requiring long-term care. And it's important to note that the Affordable Care Act under President Obama expanded coverage to 138% of the federal poverty level in most states. Another interesting fact, about half of children born today are covered by Medicaid. And this is a pretty well-known fact about Medicaid today. So Medicaid and CHIP. What's CHIP? Well, The Children's Health Insurance Program was established in 1997 as a means to provide coverage to children from working families who make too much to qualify for Medicaid. So most states set CHIP eligibility at 200% of the federal poverty level. Nearly 7 million children today are insured by CHIP. Medicare. Medicare was established in 1965 as a federally funded insurance option for adults aged 65 and older. It has now expanded to cover the disabled, individuals with end-stage renal disease, and adults 65 years of age or older who choose to join Medicare plans. 44 million, or 17% of Americans are enrolled in Medicare, and this is expected to reach 79 million by 2030. That is a lot of people included under Medicare. So active military servicemen and veterans. There are 1.3 million active military and 800,000 reserve members today. And this is from governing.org. There are over 22 million veterans in the United States as well. And what's now only 7% of Americans was once 18% in 1980. So there are less veterans as a proportion of the population, but it's still a huge, huge, huge amount. So active military servicemen and veterans for health coverage, there's, of course, the active military, in which they receive their care within the armed forces. Veterans Affairs, which includes veterans and eligible family of service members. And there's also TRICARE, which includes active duty, women, and eligible family, and some veterans. It's complex, but it is a lot of people included in this category. The Indian Health Services. The IHS is responsible for providing comprehensive, culturally competent medical care to American Indians and Alaskan Native groups. It was established in 1976. The IHS provides care to 573 federally recognized tribes in 37 states and over 2.5 million American Indians and Alaskan Natives. That's a lot of people. So let's take a step and look at private medical coverage. Where do people get private medical coverage? Well, employer-sponsored coverage. This is the most common way in which Americans receive health insurance. Nearly 60% of people receive coverage through a workplace. However, this is declining as the costs and burdens of providing health coverage for employees are increasing. So smaller businesses sometimes struggle with offering employer-sponsored health plans to their employees. So we'll get to our other private-based plan, which are the individually purchased plans. Since 2010, these individually purchased plans are mostly via the exchange, also known as the marketplace, which was a part of the Affordable Care Act. The marketplace is the entity helping individuals, families, and small businesses shop for and enroll in affordable medical coverage plans for those not covered by their employers or their state. So the ACA created this marketplace and provided consumers with subsidies or tax credits for those with household incomes of 100% to 400% of the federal poverty level. So this helps those people who may not, who have lower incomes, and they may make too much to qualify for being in poverty. However, they may not be able to just afford health coverage, which can be expensive. Next, let's look at an entirely different subset in comparison to private or public coverage, and this is the uninsured. In 2017, 27.4 million non-elderly individuals did not have medical insurance or health insurance. That is a huge number of Americans. 75% are U.S. citizens and 86% are adults. So what's important to note here is that these Americans are postponing necessary preventive services or even treatments of existing conditions. So this is a very, very big problem in the US. So wait a minute. Isn't this lecture series about oral health? What about teeth? Have we even talked about dental coverage? Well, dental coverage, where it comes from. It can also be broken down into public versus private entities. We'll start with public. There's Medicaid, there's the military or the VA, and there's the Indian Health Service. Wait, aren't we missing one? Medicare coverage for dental? Unfortunately, this is not included as a part of Medicare. Older adults may purchase dental plans at additional cost, but their coverage of services is pretty minimal. Most older adults pay for dental care completely out of pocket. And like it says here, available Medicare Advantage plans Part C may offer dental benefits if purchased separately. Again, they are typically limited. This is a population who needs it really the most. Medicaid coverage for dental. Children covered by Medicaid have dental coverage as a part of EPSTD, which is the Early and Periodic Screening, Diagnostic, and Treatment Benefit. This was a very, very important part of the Affordable Care Act. Adults covered by Medicaid have coverage only if the particular state allows it. So some states provide no benefit, others provide emergency dental services, and fewer than half of states provide comprehensive care for adults, which is unfortunate. As of 2019, 36 states have adopted Medicaid expansion, which provides at least limited dental services to adults. So we are making strides in the arena of Medicaid, but we have a ways to go. So what about CHIP coverage for dental? We talked about CHIP and how it covers about 7 million children in the US for health coverage, but what about dental? Well, again, this EPSTD benefit of the Affordable Care Act in 2010 deemed dental an essential health benefit for state Medicaid programs. It was essential that they had it in their plans. So 38.5% of kids do have dental insurance through Medicaid and CHIP. Now, the caveat here is that the Affordable Care Act deemed these benefits essential but not mandatory. So not all states do provide dental as a comprehensive benefit on these plans. So let's talk about active military servicemen and veterans. Dental. This does get a little more complicated. Active military, they are able to receive specific branch-related care. So, the Army, Air Force, and Navy typically have dentists located at bases who provide care to active servicemen, women, and families. The Veteran Affairs, well, recently discharged service members, inpatient service members, and those with service-related disabilities, deeming them unemployable or 90 to 100% service-connected disabled, are provided comprehensive dental services at the VA. Again, it's a little bit more of some limited groups who are able to receive this. I trained at the VA, so I did have, a lot of experience with these patients, but it's not all veterans, unfortunately. So next there's TRICARE, which is a program for servicemen and women. This is a newer program who are active duty or a part of the National Guard, or families, retirees, survivors, Medal of Honor recipients and families. This is something where it enables veterans and, like I said, family members of military servicemen to get care in a community-based setting through a regular dentist, but it's insured through TRICARE. So there are limitations to this as well. But if you do know someone who's a member of the military, have them contact their benefits manager to really figure out what they're eligible for. And lastly, the Indian Health Services, dental coverage. The IHS is responsible for providing comprehensive, culturally competent dental care to American Indians and Alaska Native groups. However, it's important to note that many tribes reside in areas without an active dentist. So American Indian and Alaska Native groups are among the highest need for dental and some with the lowest access to care, which is something we'll get into later. And next, we'll look at dental coverage, the private entity, which of course is employee-sponsored or individually purchased. So employer-sponsored dental. 58% of working age adults and about over half of children have employer-sponsored dental insurance. This is huge. But this is changing. Again, employers are not legally responsible for providing dental insurance to full or part-time employees. Many don't offer it at all. But it's really great that they do have, that these are the numbers based on a report from 2016. And individually purchased dental plans. These are also called standalone dental plans. So standalone dental plans may be purchased, however, they tend to be expensive with limited coverage. Paying the full price out of pocket may even save more than a standalone dental plan in some cases. So wait a minute. If I want a standalone plan, can't I buy one of these from the marketplace? Well, no, not always. Not unless you're also planning a health plan. Can you buy a health or a dental plan from the marketplace? Otherwise, you'll have to go through a private entity. Now, what do all these dental plans even cover? Well, the truth is, unfortunately, not that much for a lot of them. Plans typically cover preventive care and basic restorative needs. Better plans, typically the ones through employers, have a maximum of $1,500 to $2,500 per year, and that is quite a bit. But it stands that dental care presents the highest level of financial barriers related to health. It is one of the biggest reasons for out-of-pocket health expenses. So 40% of dental expenses in the US are out of pocket. Cost is the top reason that Americans forego dental care. And this is all material from Mark Vujicic. And remember, avoiding care leads to more severe problems with even more costly solutions, which may include life-threatening emergencies and higher costs. So it's really unfortunate that cost is the biggest deterrent for people from going to the dentist, because delaying those problems only makes things more expensive. So what happens if you don't have dental insurance, though? And this is extremely common. Well, who's at greatest risk for being uninsured for dental care? There's low-income groups, the unemployed, part-time employees, retirees and elderly, disabled adults, immigrants, and special needs groups. This isn't an entire list, but this is just some. And the uninsured. Unfortunately, there are 4 times as many as Americans uninsured for dental as there are for medical. This has reached over 74 million people, and this is data from 2016. Over 10% of kids and 33% of adults, non-elderly adults, that's a third, are uninsured for dental care. And unfortunately, these numbers are even higher for older adults, since dental is not a part of Medicare. So what can you do? Well, find out your coverage. Find out if you have it. Employer versus state. Step 2, if none, research your eligibility. Look at the exchange. Look at the state. Think about private plans, or just think about finding the means to pay for these services out of pocket if the private plan won't pay out like you think that it might. Step 3, access in-network provider or call local dentists. Find out where you might be able to access care. Step 4, prevent, and do not delay care. That is extremely important because problems will only worsen and become tougher to treat and likely become more expensive. And step 5, don't give up. Thank you to our sponsors. With questions regarding this module, please contact BreckyHuddleston@gmail.com, and we will see you next time for part 2, our very last part in this lecture series. Thank you for joining us.